Medical expertise is unevenly distributed. When clinicians encounter rare or complex cases, identifying the right precedent and referral path is difficult, and even major centers may not provide the exact capabilities required. CaseTwin addresses this gap by retrieving historically similar cases with known outcomes. Using MedGemma for multimodal clinical reasoning and MedSiglip for deep image similarity, it matches real prior patients to the current case, delivering fast, transparent, case-grounded insight beyond generalized guidelines. A clinician opens a new case and drags and drops the available raw evidence directly into the clinical co-pilot chat, such as an imaging study, for example, an X-ray, and an unstructured referral note. Immediately, MedGemma begins extracting and organizing information. On the left, it builds a structured case profile by reasoning across both the text and the image. You see clean sections like patient details, presentation, findings, and an initial assessment. A profile completeness score updates as the system extracts more signal. If a medical term is unfamiliar or ambiguous, the clinician does not need to leave the platform. They highlight the phrase and click Explain with AI, and the system converts it into clear clinical context in place. Next, the clinician can click Enhance Profile. CaseTwin generates a concise clinical synthesis that summarizes the patient's condition into an easy-to-digest narrative. Once the profile is complete, the clinician clicks Match. This triggers CaseTwin's hybrid matching flow. Behind the scenes, it combines deep clinical context with MedSiglip image embeddings to scan historical records and surface the top 10 closest case twins. Each result card shows a match score and the known outcome, so the clinician can prioritize cases that actually inform decisions. To validate a match, the clinician opens an in-depth comparison view. The current patient's X-ray is placed side by side with the matched historical X-ray. A comparison matrix highlights what aligns and what differs across clinical factors. With one click on Run AI Analysis, synchronized visual overlays and an explanation appear explicitly connecting image similarities to clinical reasoning. It is not just a similarity score, it is an explained match. If the clinician needs source-level confidence, they can open the full historical profile and follow embedded links to original references like PubMed or PMC. And if there is a specific question, the Twin Chat Copilot can answer directly from that matched patient's record without forcing anyone to read a long paper under time pressure. Finding the right precedent is only half the problem. The outcome often depends on where you send the patient, a facility with the exact equipment and specialists the case requires. Route solves this. CaseTwin uses real-time web intelligence to surface candidate facilities, then filters them by required capabilities, like interventional radiology, 3 Tesla MRI robotic surgery, or a pediatric ICU. Each result includes estimated drive time and an AI-generated case-specific rationale. Select a hospital, and CaseTwin goes one step further. It searches the physician directory, extracts the most relevant specialists, and provides names, credentials, and direct contact links, so the clinician can act without making rounds of calls. Then, CaseTwin generates a structured communication memo, including the presenting complaint, match rationale, recommended protocol, and transfer logistics, ready to copy or export. CaseTwin, bridging the global expertise gap. Do not guess, match.